a stock market edition because there are some interesting things happening with both the Eli Lilly and Novo Nordisk stock, and I'm here to give you insight into why that is. Here's a little tease. It has something to do with the stock handle Vktx, that's Viking Therapeutics. If you've followed this channel for any amount of time, you know that they are the manufacturers of the investigational drug Viking Tide, VK2735 to be precise. This is an injectable, subcutaneous injectable GLP-1 and GIP receptor agonist, similar to what? Mounjaro, Zepbound, Tirzepatide, which is also GLP-1 GIP. But there's a couple unique things about Viking Tide. We'll get into what those are and what exactly spurred this rise in the VKTX stock today and a subsequent lowering of the Eli Lilly and Novo Nordisk stock. So Viking Therapeutics had an earnings call and they shared a little bit of information about VK2735. As I mentioned, this is an oral formulation, an injectable formulation of GLP-GIP, but they also have an oral version of this. So we're going to talk a little bit about both. So what did we learn today that has the stock jumping for VK2735? Hey, if you're just joining here, welcome. Hit that like, hit that bell, hit that sub, drop your name in the chat. Let me know that you're here. I would love to welcome you by name. But Viking Therapeutics announced yesterday that they are moving past a phase 2B trial for the injectable version of VK2735. And they're moving straight to phase 3 clinical trials. So as soon as this phase 2 trial wraps up and they work through everything they need to work through with the FDA, they will be beginning a phase 3 clinical trial, which is, of course, the last phase that needs to happen before the medication can be submitted to the FDA for approval. So assuming that we get that phase 3 trial starting sometime in 2024, it could be 2026, potentially late 2026, that we could potentially see VK2735 hit the market. That is probably a really optimistic view. It's more likely to be 2027, but it does move the timeline up for VK2735. And that's why you see the stock jumping for Viking Therapeutics today, because this is a really, really strong contender to the current drugs that are on the market from Eli Lilly and Novo Nordisk. Of course, the exciting thing is that this is a third manufacturer getting into the game with a really potent drug potential. And that is very exciting for this entire class of medications. Hey, Tanya. Hey, Deborah. Hey, Tay. Welcome. Good morning to you. We're talking about Viking Therapeutics. So as of current, we see in the Novo Nordisk stock, it's trading almost 3% lower. Lilly is trading almost 5% lower, while Viking Therapeutics is up almost 30% on the ticker. And so that is on the news of the bumping up of the Viking Therapeutics VK2735 phase 3 trial, meaning for us as patients, we don't get a lot into stock stuff here, but just giving some context from the patient perspective, that means more medications sooner. That's exciting. Gina, welcome. Thank you for being here. I want to jump into for a couple minutes the oral version, because the oral version of VK2735, so they have this injectable version, and in phase 2 clinical trials, they also have an oral version. And I want to talk to you a little bit about that, because really that's where I see a lot of potential and a lot of promise for Viking Therapeutics. Why? Well, first of all, the only other incretin mimetic drug that we have available in pill form is Rybelsus. And we saw that even Novo Nordisk tested high-dose Rybelsus up to 50 milligrams, which is almost 4 times the upper dose currently of 14 milligrams. And they have yet to bring that to market, right? But with that formulation, the oral version of semaglutide got all the way up to where their injectable is for Wegovy, right? That 2.4 milligram dose weekly with the 50 milligram dose daily of Rybelsus, you got up to the Wegovy weight loss level results. And that's amazing. But you've seen Novo Nordisk be hesitant to submit that to the FDA for their authorization to bring that to market, because the active pharmaceutical ingredient is a issue for Novo Nordisk. They have told us that they are the only manufacturer of FDA-approved semaglutide. They don't work with external partners to make the API, and so they rely on their own infrastructure to build that, and it's simply, at this point, is just there's not enough API when you think about 2.4 milligrams weekly versus the 350 milligrams weekly that it would take for Rybelsus to achieve the same results. Now, VK2735's oral formulation, what we learned today is at the high dose that they were testing in the phase 2 trials, they were at 40 milligrams, right? Which was really high and really exciting because people were not experiencing side effects compared to what people have experienced on Rybelsus or even the previous generations of incretin mimetics, which is exciting. They told us at the time on the last earnings call that they would continue to ramp up the dosing schedule. What we learned on this earnings call is they actually ramped that dose up to 100 milligrams daily of VK2735. This is a oral peptide GLP-1 GIP coagonist. And so that's really telling. So they're obviously telegraphing that these high doses, we're still not seeing the same level of potential adverse reactions or side effects that potentially you see with the earlier versions of semaglutide, which is just a GLP-1 agonist. Hey, there's 48 people in here. If you'd hit that thumbs up button, I would greatly appreciate it. We've got 8 likes and 48 watchers, so I'd appreciate it if you hit that thumbs up. That'll help other people see this information. So thank you for those who are doing that. Drop an N in the chat if you're new here. Let me know that you're new. I'd love to welcome you by name. If you're an OG, drop an OG in the chat. I would love to say hello to you as well. Thank you for being here. So we're going up to 100 milligrams daily with VK2735 oral, and that is really exciting. That's a lot of API though, right? So I think that would be a harder one to bring to market if API manufacturing is a hiccup. But here's why I think that that's sort of the dark horse in this whole conversation about Viking Therapeutics. I believe that because Viking Therapeutics, if they're to bring another pen to market, right, another injector pen version of a GLP-1 GIP incretin mimetic drug, I have a feeling that by the time they bring this to market in late 2026 or early 2027, all of the potential manufacturers for pens will have been gobbled up in contracts by Novo Nordisk and Eli Lilly, who are essentially at this point just printing money. And so for the future of those two companies acquiring, building out infrastructure to make pens and fill pens is the name of the game right there. It's a race for capacity. So for a small company like Viking Therapeutics to sort of weasel in there and gobble up manufacturing capacity is going to be a tall order. But manufacturing peptides is a pretty simple process. And so my thought is they can probably scale manufacturing of API a lot easier than they can scale manufacturing of pens. And that's why the oral formulation of VK2735 to me holds so much promise. Let's talk about that for just a minute. When you consider the injector pens being a real kink in the supply chain, you also have to consider the fact that these pens have to maintain sterility. Then they have to maintain a temperature control. And we made some videos about that earlier this week that I think were very informative if you want to go back and check those out. But cold storage is required for all of the current injectable GLP-1 medications. The oral formulations do not require cold storage, so you're able to scale manufacturing because pills are a lot easier to manufacture than pens, and you're able to bring it to market without this cold storage, this need to maintain a temperature with these medications. And so for those reasons, I think that is why Viking Therapeutics is a huge opportunity right now. Again, today, the Viking Therapeutics stock is up almost 30%. And I really feel like this is really good news, obviously, that we got on the moving up of the injectable phase 3 trial. That gets people excited. But I really feel like the oral formulation of VK2735 is where this value, this perceived value is coming, because orals are going to change the game. Now, it is a peptide, it's an oral peptide, so there are challenges with absorption rates, bioavailability. Peptides are very hard to maintain sort of stability when they're consumed orally. That's why you see Eli Lilly their next generation of incretin mimetics in pill form are small molecule GLP-1 receptor agonists, because peptides are so difficult to manufacture enough API to get the desired result. But small molecules are a little bit easier, trickier manufacturing though. And so that's why you see Eli Lilly already building out infrastructure to manufacture orforglipron, which is their small molecule, which will hit the market sometime in 2026. So there are a lot of things on the horizon which make this very exciting to be sort of following all this information. I just wanted to give a little bit of context, at least my perspective, on what I think is happening today with the Eli Lilly stock, what is happening with the Novo Nordisk stock, and of course what is happening with the Viking Therapeutics stock. That's going to be Vktx on the stock exchange. So pill versus injection, Sonia wants to know which is more effective. The injections are definitely about a generation ahead of what the oral formulations behind it are. So when you talk about orforglipron, you're probably going to talk about weight loss that's similar to Ozempic or Wegovy, right? But with this oral formulation of VK2735, perhaps we could see higher weight loss over time. Early on in the clinical trials, it was actually a very high placebo weight loss. So it was like 3.3% weight loss in a month on placebo, which is a very high placebo number. And their VK2735 oral formulation, again, this was smaller doses at the time, but they would see for what they were foreseeing in that 1 month weight loss is people on the 20 milligram would have continued to lose. And so that was 20. Now they're 5xing that upper dose to 100 milligrams. I believe they were going all the way up to 40 before, now to 100 milligrams. So you may ultimately, over a 48 or 72 week trial, see an oral pill that could achieve potentially maybe what the current GLP-1 GIP medication in Mounjaro and Zepbound, Tirzepatide does. So for now, the injectables will maintain an edge as far as effectiveness for weight loss, but we'll see. Michael says each person may absorb more or less at what percent, but at what percent? Yeah, and that's there. It's going to be a huge, if you look at Rybelsus is really the only thing on the market that we have to compare it to, and there are a lot of rules about when you can take Rybelsus, how much water you can drink, when you can eat food, because of all of this stuff. So as Mama Slew mentioned, if you would hit that thumbs up button, that would be greatly appreciated. The likes always help, and the engagement, the comments help, so thank you for being here. So that is where we're at. That's where we're at with VK2735, the Novo and Lilly and Viking Therapeutics stocks today. This is an exciting topic. Tanya says Rybelsus does not work good. For many people it doesn't, but for others it seems to. Obviously, the higher dose version that is past clinical trials that needs to be submitted and approved by the FDA, but they'll go up to 50 milligrams. That, I think, is a real potential game changer. But as I mentioned earlier in this video, I don't see a lot of hope for that coming to market anytime soon, because I don't think Novo Nordisk has the capacity to make 145 times more the active pharmaceutical ingredient for the daily pill versus the weekly shot of Wegovy. So 2.4 milligrams weekly versus 350 milligrams weekly of the Rybelsus 50 milligram daily. I just don't see their capacity being at a place where they can actually bring that to market. If they could, it would be an absolute game changer. 50 milligram Rybelsus would be an absolute game changer. So I hope that we see that this year. I believe that would also be for the obesity indication and not the type 2 diabetes indication. So chances are it would probably come to don't quote me on this, but chances are it would come to us in the form of an obesity indication, like Wegovy is the obesity indication of semaglutide, and Ozempic is semaglutide for diabetes. I think that, Yelly, welcome. Thank you for being here. I think that we'll see it rebranded, and so it probably won't be called Rybelsus, but it'll be called, something else. And so that is sort of what I'm seeing now. If you have any questions before we hang this one up, please put it in the chat. I would love to answer any questions that you may have. How much of the medications get lost in the stomach and the natural function? Yeah, that is a really good question. I mean, it's just peptides again. Oral peptides are very difficult to sort of predict. And so that's why you have to I believe Rybelsus has to be taken on an empty stomach. I believe that you can't drink water within 30 minutes of taking it, or eat food, something like that. It's like the gremlin of incretin mimetics. So if you are just joining here, make sure that you hit that subscribe button, get notifications. This is the type of news that we share it on the pen. I am Dave Knapp, man on the Mounjaro. I've been making content about incretin mimetics, especially documenting my journey on Mounjaro as a type 2 diabetic now for almost 2 years. And this is really on the pen, has become a trusted source within the community for news. I just went through a couple of articles this past 2 days. Bloomberg had an article about 503A versus 503B pharmacies and the difference and why it's important. Of course, I put out an article at onthepen.com about that back in March. Thank you, Tanya, for the $4.99 super sticker. I really appreciate that. All the gifts are greatly appreciated. They're never expected, but they're always appreciated. Thank you for supporting the work that I do in that way. And so the other article that I'd covered way back in April was Roche, who acquired a company called Karma, and they have 3 obesity candidates that are really exciting too. And so you're seeing that kind of bump up in the news. I think maybe that was like CNBC or somebody that covered that this week. And of course, we covered that all the way back in February, I believe. So it is super, super important, if you like to follow this kind of information, that you jump over to onthepen.com, sign up for email alerts, because we have a book coming out in the next few weeks, about 4 weeks. I'm looking for the launch date. The book is called On the GLP-1 Pen. It's a beginner's guide to GLP-1s, and my heart and soul behind this book is that it would be a book that you can read, understand a little bit about my journey, understand a little bit about the history of these medications and the future of these medications, but it's really written from the perspective of you being able to pass this book off to a loved one in your life who you just desire for them to understand the medications that are changing your life, how they work, how they're not what people think they are. They're not a silver bullet. They're not a magic pill. They're not the easy way out. They're not the obesity medicines of old like fen-phen. They are changing the game in metabolic health. That's what this book is about. So jump over to onthepen.com, sign up for email alerts. I would love to be able to share that book with you here in the next few weeks. And I hope that it will be a game changer in the conversation and the discourse around these medications, and that it will help to remove stigma and help people to just have a better understanding of each other. Thank you for being here. Thank you for being the best part of what we do at On the Pen. Please hit that thumbs up before we go. If you enjoyed this information, considering sharing this into a Reddit forum that you may be in, anybody that exchanges stock information about these companies that are making this class of medications, or anybody who just desires to know about the future of obesity medicine. And we will catch you on the next one. Thank you for being with me.